uh, class 12, housewife resident of Uch Sharif. If married for 8 years, gravid 4, para 3, previous 3 cesarean section, and last childbirth 3 years back. Her LMP was her last menstrual period was 6 April 2020, and expected date of delivery is 13 January 2021, making her gestational age of 38 weeks plus 2 days. Admitted on 29th December uh, uh, through outpatient department in Sheikh Zayed Hospital, Rahimia Khan, for uh, with the complaints of gestational amenorrhea of 38 weeks plus 2 days is and evaluation and management of increased blood pressure. Increased blood pressure and uh, deciding the time of delivery. According to my patient, she was having regular menstrual cycle, and 5 by 28, and then conceived spontaneously. I conceived spontaneously and confirmed her pregnancy by urine for pregnancy test in home. Then she booked herself in nearby clinic where her ultrasound has been performed, and told to her that single alive pregnancy, and her blood pressure was checked, and blood pressure was checked, and that was reassuring, and she was prescribed with tablet folic acid, right? And there was no history of excessive nausea, vomiting, lower abdominal pain, vaginal bleeding, discharge, and high grade fever with fever, flu, rash-like symptoms. She perceived fetal movements and end of fourth month of pregnancy, and she can correlate it with calendar month. And she was having regular natal visit, and her ultrasound has been performed in fifth month of pregnancy, and that was reassuring. That was reassuring, and she was prescribed with hematinics, and she was taking hematinics regularly. She has complained of uh, there was no history of headache, blurring of vision, epigastric pain, in pedal edema, heat and cold intolerance, polyuria, polyphagia, and polydipsia, generalized weakness, and easy fatigability, and shortness of breath. Uh, in her in her seventh month of pregnancy, during her antenatal visit, she was during her antenatal visit, her blood pressure was checked, and that was raised. At that time, her certain investigation and has been performed, and her ultrasound has been performed, and then advised her for the BP monitoring in home. Um, and according to the patient, her blood pressure was normal in all the time, and on but after in her next visit, it but after 2 to 3 weeks, she was complaining of uh, she she was having complaint of increased blood pressure with the headache, and she again revisited the outpatient department, and where her blood pressure was checked, and that was raised up to 140 by 90 millimeter of mercury, and uh, uh, and 90 140 by 90 millimeter of mercury, and she was advised for the admission in the hospital, but the patient refused, and she went back home, where she checked her blood pressure, and was taking tablet all methyl dopa 250 mg once a day, on and off. She was not compliant for taking medicine, and then she again visited in the ninth month, in the outpatient department, and her ultrasound was performed, and her certain investigation was carried out that were reassuring, and she perceived normal fetal movements, and her abdominal growth is according to her gestational age. Now she came here in the hospital for the uh, uh, um, now one day before she was having a complaint of again complaint of headache, and at that time her blood pressure was raised up to 140 by 90 millimeter of mercury, and now she is admitted in hospital where her certain investigations has been carried out and has been performed, and but no further plan of management has been discussed with her regarding regarding her obstetrical history. Her first baby, she delivered a female baby 7 years back, like by cesarean section, and that was her book pregnancy, and book pregnancy. See, and she was having she undergone a C-section due to breech, and delivered a female baby. There is no antepartum, intrapartum, and postpartum complication. Baby was of average weight, breastfed, and vaccinated. And her second baby, he was 6 years back, and that was also that was her book pregnancy, and undergone delivered by a cesarean section, and there is no antenatal, intrapartum, and postpartum complication, and her baby was of average weight, breastfed, and vaccinated. Uh, third pregnancy was 3 years back. That is male baby, delivered by a C-section due to history of increased blood pressure. That was her book pregnancy, but there was no history of antenatal, intrapartum, and postpartum complication, and there is no history of um, uh, fits. At that time also she was taking on and off tablet methyl dopa, and she was not further evaluated for hypertension after the delivery of baby, and that baby was of average weight, breastfed, and vaccinated. Regarding her gynecological history, she menarche at the age of 13 years with regular menstrual cycle 5 by 28, and with average flow, and average flow. There was no history of dysmenorrhea, dyspareunia, intermenstrual bleeding in post coital bleeding. Pap may never taken, and a patient never practiced contraception. Uh, there is no history of hypertension, diabetes, chronic renal disease, chronic liver disease, asthma, and tuberculosis in her family. There is no significant there is no significant history of any surgery except these cesarean sections. And she was there is no history of congenital malformed babies, thalassemia, and thalassemia in her family, and twin pregnancy in her family. She was having regular sleep and bowel habit, and regular sleep and bowel habit, and there is she is uh, there is no known drug allergy, non-addict, and non-smoker. her husband is a a shopkeeper, and she lives her own house. Her necessities of uh, life are met with difficulty. A 30-year-old lady sitting on a bed, well oriented of time, place, and person. Her weight is 100 kg. Her weight is 100 kg and height is 154 centimeter, making her BMI uh, 30 kg per meter square. Her blood pressure is 140 by 90 millimeter of mercury. Pulse 98. Pulse is 82 beats per minute. Temperature is 98.6 Fahrenheit, and respiratory rate 14 per minute. And there is no pallor, cholinergia, jaundice, clubbing, and all accessible lymph nodes are not palpable. Thyroid is not enlarged. The bilateral breast examination revealed no abnormality. On uh, regarding respiratory examination, and normal vesicular breathing with no added sound, and on heart auscultation, first and second heart sounds are audible with no added sound. On abdominal examination, abdomen is uh, Abdomen is protuberant and moving with respiration with centrally located umbilicus, with the scar with stria, and low transverse incision, and no prominent vein seen. Hernial orifices are intact. For some physical fundal height is 38 centimeter. Is longitudinal cephalic like presentation, and fetal heart sound 140 to 150 beats per minute, and Liker seems to be adequate, and estimated fetal weight is 2.5 to 3 kg. Dr. Shazia, investigations.
What you?
Hello.
What you investigations you need?
I need blood group and RH factor.
Blood group A positive.
Complete blood count with hemoglobin and platelets and leukocyte count.
Hemoglobin is 7 gram per deciliter.
जी.
TLC
Platelets.
15,000.
ठीक है.
Platelets 130,000.
I need peripheral picture in RBC's indices. In RBC's indices, I need MCV, MCH, or MCHC.
All indices are decreased.
I need serum ferritin.
Serum ferritin not available.
Ferritin.
J.
Hello, I need serum ferritin.
Serum ferritin not done.
Hello.
डॉक्टर हिना सीरम फेरेटिन नॉट अवेलेबल. जी आवाज आ रही है आपको?
हाँ जी मुझे आवाज आ रही है. आई नीड पेरिफेरल पिक्चर.
On peripheral blood picture microcytic hypochromic.
I need random blood sugar level.
150.
I need 24 hours record of 24-hour blood sugar level.
Not available.
I need urine complete examination, in which I need a microscopy. In microscopy, I need pus cells, and in biochemistry, I need protein and sugar.
1 to 2 pus cells, glucose 2 plus, and protein also 2 plus.
I need protein creatine ratio.
Not done.
24-hour urinary protein.
Not available.
I need liver function test, in which serum bilirubin, alkaline phosphatase, ALT, and AST.
Bilirubin is 1.2. ALT 45, AST 42.
I need renal function test, in which urea and creatinine.
Urea creatinine normal.
I need stool for ova and cyst.
Why you need stool for ova and cyst?
Because my patient is Report of stool and by patient is 7 gram per deciliter low hemoglobin. Anemic है.
Not available. जी.
I need obstetrical ultrasound.
What you need in obstetrical ultrasound? Which ultrasound you need?
I need, madam, I need dating scan.
Dating scan not available. No gross fetal anomaly. No gross fetal anomaly on anomaly scan.
And in recent scan, I need.
Recent scan will discuss later.
Madam, I need ticket.
What do you need on treatment ticket?
Ma'am, on treatment ticket, I need which treatment, which drugs she are using. In tablet methyl dopa and
She's using
insulin.
500 milligram TDS.
And last 24-hour BP record.
Blood pressure is controlled.
Tablet glucophage she is using or insulin she is using for the diabetes.
She is not taking any treatment. जी बेटा.
ठीक. सरफेस एंटीजन और एंटी हेपेटाइटिस सी एंटीबॉडीज रहती है.
नेगेटिव.
हाँ जी. 30-year-old grabbed a 4 para 3 previous 3 cesarean section and at gestation amenorrhea 38 weeks admitted for evaluation and management of preeclampsia, anemia and diabetes. Her diabetes. Her symphysial fundal height is 36 centimeter, lies longitudinal cephalic, longitudinal cephalic, fetal heart sound 140 to 140 per minute. Its liquor seems to be adequate and estimated fetal weight is 2.5 to 3 kg.
Okay, how will you manage
Hello?
her? How will you manage her?
Before my management, I want to complete my investigations. I want to know report of recent obstetrical ultrasound with color Doppler. In obstetrical ultrasound, I need to know
biometry is corresponding to gestation.
Ji.
ST ratio is 2.1. AFI is 3.
Ji.
Placenta upper segment.
ठीक. हाँ जी, start करूँ management?
जी.
As my patient is grabbed a 4 para 3 previous 3 cesarean section at 38 weeks plus 2 days with preeclampsia, anemia and uncontrolled blood sugar level. I will counsel the family that this is a high risk pregnancy. I will counsel about the fetal-maternal complications and need of hospital admission and further plan of delivery with the counseling of breastfeeding and contraception. My aim of management, I will involve the multidisciplinary team and for the management of this patient. My aim of my aim of management is to control her blood sugar level and complete her investigation by completing her investigation and control her blood sugar level, optimize her hemoglobin level, and then give her steroid cover and plan for the plan for the delivery after optimizing her plan for the delivery by the cesarean section. For the uh, for for the control of the blood pressure, I will advise the patient to the continue the tablet methyl dopa 500 mg thrice a day as her blood pressure is controlled on it, and I'll counsel her about the symptoms of preeclampsia, that is headache, burning of ear, and epigastric pain to inform me immediately. I will continue her maternal monitoring by continue BP monitoring in 6 hourly and continue fetal heart rate monitoring after 6 hourly, give her fetal kick and complete her investigations. And I will complete her investigations. I will quantify her proteins by sending her protein ratio, but because it is not done yet, and for the optimizing her anemia, I will for optimizing her anemia, I will send her serum ferritin. Then I will transfuse her 3 unit of Paxil volume and also give her dietary advice to dietary advice and deworm her empirically, deworm her, give her a tablet mebendazole 100 mg twice a day, and for replenishing her iron stores. I will advise her to also take therapeutic doses of tablet ferrous sulfate 120 to 240 milligram per deciliter. 2 tablet twice a day, 1 tablet twice a day with a glass of water. For control of the blood sugar level, I will give her dietary advice to take uh, 3 major meals and
At
three small
hour
snacks,
7, you
and
will
I
only
will
give
with
her
the
oral iron.
G
How will you manage
7
her
HPA मैंने
anemia?
उसकी पैक नहीं, पहले उसको पैक सेल वॉल्यूम 3 यूनिट ऑफ
ओके ओके ठीक है
3 ब्लड भी मैंने उसको लगाया, साथ ही आयरन ओरल आयरन भी उसको कंटिन्यू
ओके
कर दिया ना,
ठीक है
ठीक है। और साथ जो है फॉर द diabetes with the liaison with the dietitian, and I will give her diet chart and advise her to take 3 major meal and 3 snacks, advise her to walk for 30 minutes after every meal, and continue her blood sugar monitoring in 6 times as she is admitted. It, one at fasting and others are pre-meal and post-meal levels. And if as her blood sugar levels are deranged, and so I will start tablet glucophage. हाँ,
will you go for GTT in your patient or not?
no. As my patient is admitted and now she is at 38 weeks, I will monitor her blood sugar level 6 times in a day, and then accordingly I will manage. If levels are continue rising, fasting is more than 90 milligram deciliter, and random is more than 140 milligram
What if
deciliter,
she
then
was not admitted? If your
she
patient was
she
not
came
admitted and her
at
daily
30.
blood glucose level was 150, then how will you manage her?
If she is not admitted, and then I'll ask for free. Then I will counsel her to monitor her fasting blood sugar level, then random. then pre-meal and post-meal level, and I can also check her HbA1c.
Is HbA1c diagnostic at this gestation? What
No, it is
information
not
you will
diagnostic,
get
but
from
it will show the
HbA1c?
last 3 month record. बस नहीं है, लेकिन जब पेशेंट एडमिट नहीं है मेरे पास तो मैं उसको उसकी फास्टिंग ब्लड शुगर कराऊंगी, लेकिन 38 वीक्स पे मैं उसका जीटीटी नहीं करूंगी, फास्टिंग
Why
करूंगी,
not?
रैंडम करूंगी, प्री पोस्ट
Why not
मील
GTT?
ये करूंगी।
Why not GTT?
38 वीक्स तो अगर उसकी ब्लड शुगर लेवल पहले ही रेस्ड आ रहे हैं तो फिर हम उसको तो और मैं उसको लोड ग्लूकोज लोड पेशेंट का इंक्रीज कर रही हूँ। जब अगर हाइपरग्लाइसीमिया तो उसके अपने रिस्क फैक्टर्स हैं।
ओके ओके, मैनेजर।
मैं इस गेस्टेशन पे मैं इसको नहीं करूंगी। After optimizing all the conditions of the patient, then
If
I
her
will give
blood
her.
glucose random was normal and she has family history of diabetes and she presented to you at 38 weeks, will you go for GTT or not?
No, madam, I will not go for
Why?
GTT at that time. I will monitor her blood sugar level.
Okay,
Then I
you
will
need
counsel her to do her fasting blood sugar level and the postpartum period.
what information you will get in postpartum period, that she was having gestation diabetes or not?
Yes, at the
If she
in
was
the
having gestational diabetes and her blood glucose levels are settled, then how will you confirm that she was having diabetes in pregnancy?
तो मैडम वो तो हम जो है अगर उसकी फैमिली हिस्ट्री और इसके साथ है तब तो जीटीटी मैंने 26 या 28 वीक्स पे करना है।
आएंगे आ जाए
38
आपके
वीक्स
पास,
पे इट इज नॉट
आएंगे
रिकमेंडेड इन द
आएंगे आ
गाइडलाइन।
जाए। Where it's written
जी जी
that GTT cannot be done after 28 weeks. You need to send me a reference for this.
मैम गाइडलाइन में यही लिखा हुआ है कि आपने
मुझे
26
आप स्क्रीन
24
शॉट
और
भेजेंगे
28
इसका।
वीक्स पे करना है।
28
जी
पे करना है वो उसका है, अगर पेशेंट आपके पास बुकड है। If patient is
ठीक है।
not booked and she presents later to you and there was indication for GTT after 28 weeks, then how will you diagnose her diabetes? You need to send me a reference for this or contraindication of GTT in third trimester.
पेशेंट के 6 लेवल्स नहीं कर सकते, लेकिन जीटीटी अगर तो
GTT
देखें
is
हम
diagnostic test. GTT means that you need to check her glucose intolerance by giving glucose load. 6 levels are
ठीक है
normal random levels. What information they will give
ठीक
you?
है,
Is there any difference between 6
लेकिन हम
levels and
ग्लूकोज
glucose
लोड नहीं
load?
पेशेंट को बढ़ा देंगे एट द एंड, अगर मैं
If
उसको
her random
38
levels are
वीक्स पे मैं
normal,
उसका जीटीटी
if
करूंगी।
her random level is normal, then how her glucose load will increase?
तो अगर रैंडम लेवल नॉर्मल है तो फिर मैं उसका क्यों जीटीटी करूं?
If
उसकी कोई प्रीवियस हिस्ट्री भी नहीं है, सिर्फ एक उसकी हिस्ट्री फैमिली हिस्ट्री, उसके मदर और
is
फादर डायबिटिक
GTT
है, तभी मैं
indicated in
जीटीटी
on family
कर लूं
history,
38 वीक्स।
positive family history or not?
फैमिली हिस्ट्री जी जीडीएम के रिस्क फैक्टर्स में है फैमिली हिस्ट्री। नहीं, उसके रिस्क जो 5 रिस्क फैक्टर्स हैं जीडीएम में जीटीटी
Then
कराने के
will
लिए,
you go for
उसमें
GTT
फैमिली
or
हिस्ट्री है।
not?
डॉक्टर शाजिया ये पहली दफा ये 38 वीक्स में मैं उसको क्यों करूंगी? अब तो देखिए उसका A5 है और फिर उसके बाद उसके ब्लड शुगर भी है, तो मैं
What is
उसको
recurrence of
ऑप्टिमाइज करके
gestational
स्टेरॉइड
diabetes?
कवर दे।
What is
जी
recurrence of gestational diabetes? If you leave her undiagnosed in this pregnancy, what is normal amount of glucose in half liter cola drink?
नॉर्मल अमाउंट ऑफ ग्लूकोज इन हाफ लीटर, नहीं डॉक्टर
Or
शाजिया
what
मुझे
is
नहीं पता।
normal amount of glucose in one mango, average size mango? Search करें.
सर्च करें डॉक्टर फरजाना, सर्च करें।
Okay,
हाय अल्लाह।
you will
अच्छा
send me a
ठीक है।
reference
अच्छा
for
अब
this.
मुझे डॉक्टर शाजिया ये
Manager
कंक्लूजन
patient.
हमारी हुई कि हमारे रिस्क फैक्टर्स हैं और हमने पेशेंट को जब भी
Dr.
आई
Fazal,
है
the
बेशक
question
कोई
is,
भी
if
gestation।
GTT was indicated and
हम्म
patient presented to you at 30 weeks or later, will you do her
हम्म
GTT or not? And you need to answer me till evening.
ठीक है, मैं अभी
Okay,
सर्च करती
manager, you have only 1 minute.
हूँ। ठीक, हाँ
When
जी।
will you deliver
आफ्टर
your GTT?
ऑप्टिमाइजिंग माय पेशेंट आई विल गिव स्टीरॉइड कवर after optimizing all the condition of the patient, and then I will take anesthesia fitness, arrange blood, and then prepare the patient for the cesarean section, and
Have you
सिजेरियन
discussed with
सेक्शन।
her contraception?
जी मैडम, मैंने उसके साथ डिस्कस कर चुकी हूँ। जब मैंने आपको बताया मैं एम ऑफ मैनेजमेंट पे मैंने उसके साथ
But she
कॉन्ट्रासेप्शन,
wants.
ब्रेस्ट फीडिंग एंड गुड।
But
हाँ
she
जी।
wants. मरीज क्या चाहती थी
शी वांट।
कॉन्ट्रासेप्शन के लिए?
जी
क्या चाहती थी
जी
कॉन्ट्रासेप्शन
जी।
के लिए?
शी मैडम शी वांट्स जो है उसने मुझे कहा था कि वो बाद में कॉन्डम
ओके
कॉन्डम
ओके
यूज करेगी। वो
ठीक।
पहले भी उसका मेथड यही रहा है पिछली सारी प्रेगनेंसीज में।
ओके ठीक है।
After optimizing all the conditions of the patient, then I will prepare the patient for cesarean section, and with the liaison with the anesthetist, hematologist, and neonatologist. And then
Why you need
one day
hematologist?
hematologist blood arrange उसके लिए वो करवाऊंगी ना।
अब आपने पीसीवीज लगा तो लिए।
लेकिन फिर भी प्रीवियस 3 सिजेरियन सेक्शंस हैं, पेशेंट की प्लेसेंटा बेशक अपर सेगमेंट है, लेकिन